It's Birdman for Summit Healthcares, and today we are going to be talking about children, I believe. I've got with me
Yes.
Christine Harper. How are you today?
I'm doing fantastic, Rob. Thanks.
So, what is your position with Summit, and where are you at? And just give us the rundown and tell us what you do.
All right. So, I am a certified speech language pathologist. Typically, I'm our pediatric outpatient speech pathologist, but I also cover the hospital when needed or other outpatient. So, yeah.
Okay, cool. Yeah, I don't know why I always feel self-conscious whenever I'm speaking around a speech pathologist, but
Ooh.
there it is. Yeah, I know I stumbled over the word.
Yes.
But talk to me about what are we focusing on? This month is
So this month is Better Hearing and Speech Month. It's really pushed by our national organization, ASHA. ASHA. So each day we kind of focus on something different about our scope, our field, just because it's so broad. So what I primarily work with is feeding and swallowing, speech articulation, language, cognition. We cover pretty much the neck up. So
okay. I found it interesting. I didn't really know much about speech pathology, but you deal a lot with swallowing,
yeah.
and that's one thing that is directly related to speech. Can you tell me how that works out exactly?
So it kind of just falls into our field because a lot of the muscles we use for speech, we also use for swallowing. So, especially in the hospital, that is our primary concern, is that somebody is able to swallow appropriately. So, what that might mean is going down the wrong tube. We do not want it to go down the wrong tube into the lungs and causing an aspiration pneumonia. So,
Okay, and go and tell me a little bit more about aspiration pneumonia.
aspiration pneumonia is when any material, whether it be water, food, whatever we're chewing on, is going down into the lungs and causing an infection.
Okay, and then obviously we run into a bunch of other issues, and what has to happen if that happens?
So, what has to happen is we really have to find what the appropriate diet is for that person. What we might do is thicken their liquids so they're moving a little bit slower, modify their swallow so they anatomically are able to trigger a different way, like tucking their chin, turning to the affected side, things like that. We see this a lot with stroke patients, with traumatic brain injury patients, and also just presbyopharyngeus, the aging of the larynx. So,
Start to lose control of the muscles? Is that what
yes,
happens?
there are over 30 muscles that work for your swallow. So, it's very important to have all of them working together.
Very good. What other things do you focus on that people might not know?
Well, like I said, our scope is pretty broad, and being the only outpatient services that cover all three disciplines, we see a wide variety. I would say people are surprised when I end up working with children with autism spectrum. That I don't think it's surprising. It's just that to see what we can do for each individual child and each individual family can be really surprising.
Very good. When we talk about speech and then we talk about hearing, are they related to? Do you have sometimes issues where speech drives the hearing or the hearing drives the speech?
Absolutely. Most of the time, children are required to have an audiology exam prior to a speech evaluation, just so we can see if there's any underlying factors through hearing loss, frequent ear infections, things that can impact that speech development. I also do oral rehabilitation where somebody with a severe hearing loss is starting to hear things again, even just like those early developing sounds like p and b. So we can start at that early level with a hearing loss.
Very good. So let's talk about how someone gets more information from you. Where do they get that?
Well, I really love Better Hearing and Speech Month just because this is the time when I do short little videos every day about something different in our field. You can usually find these on Facebook. Uh, but it's short little information. I always tag information from ASHA. Again, it is the American Speech Language Hearing Association, ASHA. I think they have great information for families, for people who are affected, and also for professionals.
Very good. Awesome. So we'll check that out. Maybe we'll link down the Facebook. Is it a special profile for just the speech and hearing, or is it overall with Summit?
Overall with Summit, I really try to attach it to Summit's Facebook page, and again, they're just short little videos that are funny, but all facts.
Okay, and just remind everybody once again your location for your facility.
Absolutely. So I primarily work out of our Eagle Plaza location, that is just north of the Safeway in Lakeside. It's on the left-hand side if you're heading down towards Honda.
Very good. Awesome. Hey, thank you very much for your time today. Appreciate it. Christine Harper.
Yes, thanks,
Awesome.
Rob.
That's going to be it for this episode of Summit Healthcare's I'm Birdman, reminding you, be healthy.